Immune globulin. Report these code with the appropriate administration code. Immune globulin, IG, human, for intramuscular use. Immune globulin, IgIV, human, for intravenous use. Immune globulin, SCIG, human, for use in subcutaneous infusions, 100 mg, each. Botulinum antitoxin, equine, any route. Botulism immune globulin, human, for intravenous use. Cytomegalovirus immune globulin, CMV-IGIV, human, for intravenous use. Diphtheria antitoxin, equine, any route. Hepatitis B immune globulin, HBIG, human, for intramuscular use. Rabies immune globulin, RIG, human, for intramuscular and/or subcutaneous use. Rabies immune globulin, heat-treated, RIG-HT, human, for intramuscular and/or subcutaneous use. Rabies immune globulin, heat and solvent/detergent treated, RIG-HTS/D, human, for intramuscular and/or subcutaneous use. Respiratory syncytial virus, monoclonal antibody, recombinant, for intramuscular use, 50 mg, each. Rho, D, immune globulin, RHIG, human, full dose, for intramuscular use. Rho, D, immune globulin, RHIG, human, mini dose, for intramuscular use. Rho, D, immune globulin, RIGIV, human, for intravenous use. Tetanus immune globulin, TIG, human, for intramuscular use. Vaccinia immune globulin, human, for intramuscular use. Varicella zoster immune globulin, human, for intramuscular use. Unlisted immune globulin. Immunization administration through 18 years of age viaduct any route of administration, with counseling by physician or other qualified healthcare professional, first or only component of each vaccine or toxoid administered. Each additional vaccine or toxoid component administered. Immunization administration includes percutaneous, intradermal, subcutaneous, or intramuscular injections, one vaccine, single or combination vaccine/toxoid. Each additional vaccine, single or combination vaccine/toxoid. Immunization administration by intranasal or oral route, one vaccine, single or combination vaccine/toxoid. Each additional vaccine, single or combination vaccine/toxoid. Immunization administration by intramuscular injection of severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease COVID-19, vaccine, mRNA-LNP, spike protein, preservative-free, 30 micrograms/0.3 ml dosage, diluent reconstituted, first dose. Second dose. Immunization administration by intramuscular injection of severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease COVID-19, vaccine, mRNA-LNP, spike protein, preservative-free, 100 micrograms/0.5 ml dosage, first dose. Second dose. Immunization administration by intramuscular injection of severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease COVID-19, vaccine, DNA, spike protein, chimpanzee adenovirus Oxford 1, CH-ADOX1, vector, preservative-free, 5x1010 viral particles /0.5 ml dosage, first dose. 0022 second dose. Immunization administration by intramuscular injection of severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease COVID-19, vaccine, DNA, spike protein, adenovirus type 26, AD26, vector, preservative-free, 5x1010 viral particles /0.5 ml dosage, single dose. Intravenous infusion, hydration, initial, 31 minutes to 1 hour. Each additional hour, a physician or an assistant under direct physician supervision infuses a hydration solution, pre-packaged fluid and electrolytes, for 31 minutes to 1 hour through an intravenous catheter inserted by needle into a patient's vein or by infusion through an existing indwelling intravascular access catheter or port. Intravenous infusion, for therapy, prophylaxis, or diagnosis, specify substance or drug, initial, up to 1 hour. Each additional hour, additional sequential infusion of a new drug/substance, up to 1 hour. Concurrent infusion. A physician or an assistant under direct physician supervision injects or infuses a therapeutic, prophylactic, preventive, or diagnostic medication other than chemotherapy or other highly complex drugs or biologic agents via intravenous route. Infusions are administered through an intravenous catheter inserted by needle into a patient's vein or by injection or infusion through an existing indwelling intravascular access catheter or port. Subcutaneous infusion for therapy or prophylaxis. Specify substance or drug, initial, up to 1 hour, including pump setup and establishment of subcutaneous infusion site, S. Each additional hour, additional pump setup with establishment of new subcutaneous infusion site, S. Physician or an assistant under direct physician supervision infuses a therapeutic or prophylactic, preventive, medication other than chemotherapy or other highly complex drug or biologic agent via a subcutaneous route. Indications for subcutaneous infusion may include coma, dysphagia, nausea/vomiting, intestinal obstruction, malabsorption, or extreme weakness. Infusions are administered through a needle inserted beneath the skin. Common infusion sites include the upper arm, shoulder, abdomen, and thigh. Therapeutic, prophylactic, or diagnostic injection, specify substance or drug, subcutaneous or intramuscular. Intra-arterial. Intravenous push, single or initial substance/drug. Each additional sequential intravenous push of a new substance/drug. Each additional sequential intravenous push of the same substance/drug provided in a facility. The push technique involves an infusion of less than 15 minutes. Application of on-body injector, includes cannula insertion, for timed subcutaneous injection. An on-body injector is applied by a qualified healthcare provider in order to deliver drug therapy at and for a specified time. The provider pierces the skin and inserts a cannula for drug delivery. The cannula is connected to the device adhered to the outside of the patient's body, typically the abdomen or arm. The device is filled with the appropriate amount of medication and programmed for dose delivery.